Hello, I'm Dr. Thomas Schuler, Chairman of the Medical and Scientific Board of the National Spine Health Foundation. We're interviewing the top spine specialists around the nation to find out what you can do to overcome your back problem or your neck problem. I'd like to welcome you to Spine Talk Cities 2020.
But how does a patient go about choosing the best spine practice or the right spine surgeon outside of what type of technology they may or may not use during their care?
There's a few factors. One, what's the doctor's experience? How many of what have they done? I'm a believer in specialization, but if I'm a patient, there's a lot of websites and there's a lot of rating agencies, and they can be useful, but I would caution a few things about it. One, sometimes people who just didn't connect with the doctor or had bad interaction will get on because they're angry, not even a bad result, just not a good interaction, and say, this doctor didn't care about me, blah, blah, blah. That's one caution. And sometimes there's different personalities. People who had a great result and said they're busy. They're not going to the rating agency. So I would just say they can be useful, but with caution. I would combine that kind of thing to word of mouth. But to me, the most important thing is when the patient goes to the doctor, they ask the questions. How many of these have you done? If I was your wife, mother, brother, sister, what would you do? What would you tell me to do? Please look me in the eye and tell me what I should do, given feeling like that. And three, are they comfortable with that surgeon?
I think your surgeon that you're looking for needs to have several qualities. One, they need to be technically good, which is very hard to vet sometimes from a patient perspective, right? They need to have good bedside manner and make sure you're comfortable and be able to answer appropriate questions.
Probably one of the first few things that you can do is, again, sort of check online. That's sort of a very large resource for everybody. I would say when you look up your surgeon online, there will be good things about most people, which is a good thing. If a physician is a part of a university, then you can look up their bio and sort of see how they're set up there. And oftentimes the university itself will have their own rating system. If the physician is not a part of a university, then generally, if they're well-known enough or established enough, which is always a good thing, then the community themselves will have come together and commented on this physician. I would say that although it's not 100%, especially for folks who are newer, if you don't find anything, that doesn't necessarily mean a bad thing, but it probably won't allay any fears or anxieties that you have, unfortunately. Out of habit, most people just try not to look for the bad things, obviously lawsuits or, the real red flags. At the end of the day, probably the most important thing that a patient can find, and unfortunately you can only determine this if you meet the surgeon, is just someone who you get the sense that they have a direct investment in you.
The first thing I always tell people is to ask around a little bit. In other words, ask your neighbors, your friends, if you go to church, churchgoers, who they've had operate on them. Spine pathology is very common. Most individuals have someone that they do know that has had spine surgery. So word of mouth is one very good option. Another is if you know any healthcare professionals, that's critically important. So for instance, even at the hospital that I work at, if my fiance needs some OBGYN care, I am going to speak with the nurses that are OBGYN nurses to see which of these physicians are very reputable and which do the best job doing certain technologies. So that's another. I think some of the magazines are reputable, like Top Docs, because Top Docs uses other physicians to expect for them to submit who they think are the best physicians in the area. I would always be a little wary of getting most of your information from the internet. in terms of places like, and I don't mean to insult anyone, but health grades, because many of those are patient-based platforms. In other words, you could maybe not come across as the nicest surgeon or have long wait times, and you could get detrimental grades on some of these websites versus you are a very competent surgeon. So just use multiple resources in determining who is the best. One other thing is, don't necessarily as a patient think that the chief of the university hospital is the best surgeon or someone that has the most publications. Don't necessarily run to the university setting or to someone that's written the most articles on a certain technique. Doesn't mean they're the best, because peer reviewed does not mean surgeon, clinically reviewed. It can be a very different thing, and it can be a very big disconnect.
Really pick wisely and understand the disease. There's lots of resources that didn't used to exist to understand what the right way to go forward is.
There are really talented surgeons and there are surgeons that are not. Get as many opinions as you think you need. I think knowledge is power. And we know that there's a lot of heterogeneity in terms of how surgeons and non-surgeon spine providers treat patients, whether it's injections or surgery. That disparity exists. I think that looking online reviews are helpful, but they are not the holy grail. And you have to be careful in terms of what you find on patient reviews. But oftentimes, if you go through enough reviews and if you see themes regarding one surgeon where there's a consistent positive review, don't just look at the stars, but look at the narratives that patients write about specific surgeons. Do your due diligence. It really comes down also beyond all of that. How do you feel with your relationship with that particular surgeon? Did they take the time with you? Ask them important questions. How many of these have you done? And I think if a surgeon is forthright and he's experienced and he's comfortable with his own skill set, he or she will tell you, I've done 100 of these. I feel very comfortable. I know that I'm going to be able to predict this type of result in you. If, on the other hand, there's any yellow flags that a patient gets in their own mind about the interaction with a surgeon, listen to your gut and get a second or third opinion. I think it's a healthy thing to do.
Please consider giving to the foundation to help support this education and to carry this message of hope to all of those across America.
Spine Talks is a program produced by the National Spine Health Foundation. For more information or to make a donation, visit spinehealth.org.